Hey, welcome everyone. We're here to discuss the longitudinal rotation at Jericho Road Community Health Center. I'm Dr. Gina Prescott. I'm a clinical associate professor here at the University of Buffalo.
Hi, my name is Dr. Celino. I am a clinical assistant professor at the University of Buffalo.
And we will be your preceptors for the 12-week longitudinal experience. Jericho Road is a federally qualified community health center that is composed of multiple locations throughout the west side of Buffalo. Jericho Road provides community care for patients that have limited resources, including immigrants, migrants, refugees, and in general, patients who have either a lack of insurance or predominantly government-funded insurance. We serve patients who have an ability to pay no matter what that looks like, and the pharmacy services here at Jericho Road play an integral part in developing patient care.
So, Jericho Road is strategically located on the west side of Buffalo. The center actually has multiple locations. As you can see listed on the syllabus, the main location will be on the Baton Street, and that's where you may come for your rotation, and we have other locations that you may end up going to as part of your learning experience with us. It's important to note that Jericho Road has two community pharmacy. Depending on the availability, the student learner will be able to shadow them maybe once or twice during their time with us. But the goal is for you to be immersed in the day-to-day clinical activities. And as the clinical pharmacist team, we are expected to provide high quality care and be integrated in the clinical service at Jericho Road. And we pretty much work directly with the provider, and that may be MD, DO, physician assistants, nurse practitioner, and other provider extender. And because of the unique population that Jericho Road serve, we also end up working with interpreter, medical assistants, and there's other like social workers, spiritual counselor, and other professionals that you may end up working with. I will let Dr. Prescott go over the specific activities that you may be involved in as a student on the team.
So our goals of the rotation for you coming here is to be able to collaborate with this interprofessional team that Dr. Celino just discussed and learn about the management of diseases, of the common chronic diseases that you would see in the ambulatory care setting. We're also interested in you being able to develop your clinical skills too in order to function independently and also collaboratively, and then again also to enhance those communication skills within the healthcare team. It's also important to note we're looking for students that want to become more culturally aware, provide information to patients in that manner, and be ready to integrate themselves in practice. Upon completion of a rotation with us, what we expect is that students will be able to interpret key subjective and objective information and assess patients for common chronic diseases, communicate either verbally or in writing, and possibly with the use of an interpreter to either the medical team or the patient. It just depends on where the student is located at that particular point in time during the rotation. The documentation should be concise and in a manner that's appropriate for the patient as well, or the provider, and also help assisting leading pharmacotherapy visits. And this can be a variety of things, whether it's data collection, it could be counseling patients, assisting with medication adherence as well. And then recognizing the role that pharmacists play, particularly in the ability to allow patients to get medication access. And this could be things such as learning about the 340B pharmacy program, how does a federally qualified healthcare center look different from other ambulatory care practices, and what do we provide for our patients. Some direct patient care activities that you will have the ability to participate in at our site includes patient medication device counseling, drug information questions, consults that come from providers, compliance education, attending provider visits, also attending patient visits as well, documentation of the clinical pharmacy visits, and looking and attending the access to care site initiatives that they have at Jericho Road. Some of the non-patient care activities that as a student you'll participate in could be a variety of Activities, it just depends on the rotation and when you're there and the number of other learners on site with you, but they could be different topic discussions, case presentations, in-services to the medical team, drug information as well, we've already discussed that a bit, journal club, looking at or reviewing or possibly engaging in any population health initiatives ongoing at Jericho Road, and also helping with medication adherence projects, again, if those opportunities exist while you're on rotation. And Dr. Selena is going to discuss how you can go about learning a little bit more and applying for this rotation.
Yeah. So as you can see, there is a wide variety of activity that you will be taking part in, and the goal is to make you a strong learner and like practitioner at the end. And what you'll be involved in is what we do in clinical practice. So we expect you to not only expand your clinical skills, but also gain confidence in the very like real world experience that you will need upon graduation. So if ambulatory care is something you are passionate about, if perhaps serving the underserved population is something that drives you, or if you want to like experience something different, something new, please consider applying for a rotation. For the application until sending us your CV, a letter of intent, and we'll be reaching out to you to perform an interview that may be in person or via video. But we designed this rotation to be able to meet the needs of the student, but also help you prepare for post-graduation work, may that be residency, applying for job, going into ambulatory care, or perhaps like other discipline. We'll be like working with you directly to make sure that your needs and your needs are addressed, and we're able to enhance your learning overall. So if you have any question, feel free to reach out to myself or to Dr. Prescott, and you have our contact information on the syllabus. Make sure to read it. We also added a to-do list of a few videos on core readiness to prepare you for the rotation, and we certainly look forward to meeting you, chatting with you, and see if this rotation is a good placement for you.
Thank you.
Thank you.